Welcome to the Sustainable Clinical Medicine podcast. I am your host, Sarah Smith. I am a practicing rural family physician and the charting coach. This is the podcast for physicians and advanced practice providers who are ready to step back from the busyness of their clinical day to share ideas, question everything, and redesign their clinical day. We are redesigning clinical medicine to create sustainable clinical days and create time for our lives outside of medicine. Join us for discussions with world experts who are helping design sustainable models of clinical medicine and the physicians or clinicians who have discovered or designed sustainable models of clinical medicine for themselves. Hi, everybody, and welcome back. So I'm going to introduce my guest in just a moment. It's July here, and we have Canada Day on July 1st. So we've just celebrated Canada Day here with a long weekend. And I was with family up in northern Saskatchewan in Canada doing some fishing with the family, which was super fun. The reason I kind of diverged before we talk is we're originally, as a family, from Australia. We came to Canada 10 years ago. And so I'm kind of the Aussie international medical graduate here in Canada doing rural medicine and became a coach, as you know. And then I met my first Australian doctor coach on the internet, of course, because that's where you meet everybody these days. And that is Jo Braid. So we're going to introduce you to Dr. Jo Braid, and it's so nice to have you here. We're going to have probably me revert to a bit of my Australian accent rather than my can Aussie accent for this talk, because it's going to just be kind of like talking to someone from Australia. Well, it is. So welcome, Jo, and let you introduce yourself.
Sarah, thank you so much. Yeah, it's really great to connect with you and with your audience. I love your can Aussie accent. It's really fun. And I'm a fellow international medical graduate from the UK that's now in Australia. So I have a husband with a very strong Australian accent. So I do have more of the twang than I might have had in a different household.
You're going to use some of the words that I will have forgotten in the 10 years of being here. So that's going to be super fun. All right. So tell us about you.
Sure. Thanks, Sarah. So, my name's Dr. Jo Braid. I live in Orange in regional New South Wales in Australia now. We've been here for 9 years already. I am a mum of 3 gorgeous little boys. And when we're talking about the medical bit, I am a traumatic brain injury rehabilitation physician. So I see people in the community only, don't do any of the pointy end stuff. And I also am a coach for doctors, particularly doctors recovering from burnout. And I have international clients with that and operate all of that out of home here.
Nice.
I originally trained in Nottingham University in the UK. I spent my childhood in the UK. My dad is Australian, so we were lucky enough to have a taster of Aussie life, and I was like, wow, if holidays are this good, would working here be this good? And actually, true enough, switching over in my second year of doctoring straight into Sydney, I went from 100-hour weeks in the UK down to 40-hour weeks in Australia, and I thought, oh, yes, this is great. I did my rehabilitation specialization here in Sydney, took some time out, went to Cambridge, did some research, went to Edinburgh with my husband for his orthopedic fellowship, and then we landed ourselves here in Orange. And there's a little bit more to the career as well that came in there. I ended up training in integrative medicine or functional medicine, as you might know it. There's a lot of different training you could do for that. It's much more like being a general practitioner or a PCP with extensive knowledge base on lots of different areas. So I set up my own clinic with that for about 5 years with a health coach. And we'll probably come to the resolution of what happened there at some point during our talk just now.
Got it. Wow. So Orange was on one of the short list places where I could have taken my rural scholarship that I got in medical school. We ended up in Tamworth. I can't tell you why, but Orange and Tamworth were both on the list, and Wagga Wagga was the other one. So
Right.
we
Yeah.
ended up in Orange, but we ended up in Tamworth. So I kind of know where you're at. I have an auntie in Orange.
Do you? Okay. Yeah.
Yeah.
Lovely small town, only 40,000. It's really not that big. So yeah,
Yeah.
I like it.
Now, I'm really curious, this second year graduate going from 100 hours a week.
Mhm.
My goodness, how do you do that?
I think it was not every single week we had 100 hours a week. So that was the intern year. So we're straight out of med school. At that point, we only had to do 1 year to get our full license.
Mhm.
Yeah, I remember a lot of nights. It was just two different locations, the medical half, then the surgical half, seriously hard going hierarchy. So even the doctor above me, like, made sure I knew that I felt like I was the bottom of the rung. Yeah, it was a pretty tough gig. And then yeah, I made a phone call, got a job in Sydney. It seemed to be that easy at that stage, obviously a bit of paperwork involved. And came over and found myself in the emergency department of Royal North Shore in Sydney,
Mhm.
quite quickly being the junior reg on for nights.
Mhm.
But it was okay. Like, there was that was in pediatrics, and there was a massive adult ED next door, and I had a lot of support from there. And when you only do 40 hours, not 100 hours, there's much more sort of beach time and connection time and all those good things that a young doctor would like to do at that stage. So yeah, it was a case of actually never going back. And my husband and I have talked about whether or not we'd really like to foray back into the UK system. And there's a lot of amazing things that they do there. But for us, with our choices of work-life balance, Australia and the medical system here works really well for both of us.
Got it. Yeah, interesting. Okay, so you finished up your kind of junior years and decide to do the rehabilitation, traumatic brain injury. Yeah, tell us about that. What sparkled your interest in that area?
Yeah, so funny that you should ask this. Okay, so I got a little disillusioned with medicine. Don't know if anybody can relate. And even though I was doing 40-hour weeks, or the variety there, lots of different terms, I decided to do a Pilates course. So showed up at University of Technology, Sydney, UTS, you might know. And every Friday I had to show up at uni, and I managed to get all my shifts to just about align with that. So I realized I loved looking sort of at the biomechanics of the human and that form part. And I finished the course. That went fine. Lots of anatomy. That was all okay. And then I was like, wait a minute. I don't think I actually want to change from being a doctor to a Pilates instructor till evermore. No disrespect. I think it's great that we've got so many good Pilates instructors around. And so I spoke to the instructor. I said, well, what kind of medicine would I do when I'd really look at the biomechanics? Because it actually didn't come to me straight up.
Yeah.
And she said, well, look, you could do rehab or you could do geriatrics. And I was like, yeah, okay. Hadn't done much rehab training at med school at all. Like, it was a ward in Derby. So that's not even our main place we were training in. You were lucky if you kind of got a rotation there. So I didn't really have much experience in rehab. Showed up for the specialty interviews, seemed to score myself a place. Didn't want to do geriatrics, didn't want to do general physician work. And I was on the training then from 2005 through 2009. And you asked, how did I get more interested in that sort of brain injury area of rehab? Because it's quite a vast, biopsychosocial specialty in itself anyway. So 1 year I did 6 months of spinal cord injury work and 6 months of traumatic brain injury work. And in the traumatic brain injury work at Westmead Hospital, I was sort of involved in a research project on dysautonomia. And that was the start of it. Then that specialist had a contact in Cambridge. And so then I was looking into pregabalin and its benefit for spasticity, and got published in that area, did a research project in Cambridge. So that was kind of the smattering on my CV. I'd done a lot of work with, I guess, people with brain injuries just through those few years. And then here, there's only one job. I mean, there's not many rehab jobs in the area anyway, but the female physician who had been working in the area was going back to Sydney, and so the job came up and I spruiked up my CV to look like that was my zone of genius. And I've been in this job since 2015. And as we were saying before, it's only 1 day a fortnight is all I have as my contract for this job. I can't increase that. It's federally funded. I absolutely love my team. They are very stable, and I have a great range of working age patients who mainly have motor vehicle accidents, or strokes or tumors or aneurysms. And I show up and do really really inspiring work. I think when I go there, I love what I do when I turn up there.
Nice. It's nice to have that satisfaction about putting all of that learning and expertise into a spot that also suits the other things you want to do with your life. It's kind of really that sustainability that we talk about around here. Yeah.
Exactly. Yes. So true.
Yeah. You can hear the enthusiasm going on. And then you had a part in the middle that didn't go so well. Do you want to dive in? Tell us more.
Sure. So the scenario was I just had my third son in under 5 years. You know, we often do those kind of things. And I had some hypothyroidism during that third pregnancy, and I chose to be treated by somebody with an integrative medicine background, and it all seemed to resolve, and I felt fine after a while. And I was kind of curious as to why did that imbalance show up in that third pregnancy rather than the other two. So at first it was more sort of a personal curiosity, but also I had this confidence in this area of medicine that things did resolve without having to take prescribed medicine. And look, I'm not against prescribed medicine. They definitely have a time and a place, and I'm not saying that there's any issue with certainly the research behind them and that. The thing was with training in integrative medicine, there are multiple different training courses because it's not a specialty in its own right, certainly not in Australia, and I'm not sure about in Canada and the United States. So I found myself doing an Australian course. I then did an American course. I joined a sort of mastermind with some Canadians. There was a lot of energy going out to study, to pass the exams. I seem to do that okay. And you know what? Can you or your listeners relate? You finish an exam and then you just look straight away for the next course that you have to do. Because within, I didn't feel like I knew enough, or that was enough to show up and do this work.
So interesting. You're right. I mean, we hear a lot around here of, got interested in meditations when I did the course to get certified. And I even kind of almost the Pilates, it wasn't just, I'm going to do Pilates, I'm going to go and become an instructor. It's like, just take it to the extra mile.
Absolutely. Yes, you can see history repeating itself. Yeah.
So you're in a field of medicine that doesn't have a curriculum to pass to be able to say I am and so therefore the learning is infinitely available. Like the learning could continue forever before you decided you'd done it, you'd reached the point of knowledge that was enough.
Yes, absolutely. And I think it was somewhat reinforced by the patients I was seeing as well, who are like, you're the 11th doctor that I've seen, and I'm sure you're the one with the answer. And I felt an incredible amount of pressure that, oh yeah, this finishes with me, I'm going to have the answer. And I think one of the really interesting parts of doing that work was I hadn't done my second coach training. I hadn't really realized how influential mindset work could have been with these patients that I worked with, because sort of taking on that ownership, taking on that self-responsibility, and being not necessarily accountable, but like being involved in your changes in health which is actually now what I do with my clients as a coach. I think for me, then that was part of the missing piece of the puzzle for the resolution of the condition that the clients had. Now, will say I had a great health coach working with me. She lives in Western Australia. We've never met face to face, and we had a great working relationship. And not all, but most of the clients would see her too. But I do think there was something that was just missing in that setup that I had. And I guess we move on towards the part where I was at home with young kids studying between 7 and 10 p.m. because most people were sleeping at that point. Then there'd be some feeding scenario that was happening. And then they wouldn't all go to school because they were still too young. And we chose to keep our kids at home as parents until they went to school. And I had clients and complex like gut testing results and so forth that I had to filter through and try and summarize what was the answer to that. Essentially, for me, it got very overwhelming. I felt a high sense of personal responsibility for these patients, sort of couldn't stop thinking about them, also had that exam thing. And it came to a crux when my mum became unwell in the UK in 2021. Now, let's go back to that lovely old pandemic era. It's actually still pretty fresh in most people's minds. My dad had passed the year before and I hadn't managed to get back to the UK. It was sort of when we had fortnight quarantine times in the UK and Australia and a few flights and that. Then mum came down with a mediastinal lymphoma. And she kept on bouncing back into hospital with a chest infection, and there was sort of minimal staff on the ground in the community as well. And so I had to have a little chat with my border force, essentially, to extricate myself from the country, which didn't go super smoothly, actually. It was like first time rejected. It was so hard to process that I've got dual nationality. How easy do we take it for granted that we can travel? We move as international people to Canada, and you're like, I'm not sure where your parents are.
If they're in Canberra. Well, they're actually now on the south coast. Loving
Lovely.
it.
Yes. So imagine if one of them took a turn and you wanted to get back there, you would think that you would be on a flight within 24 hours. So, that was a little hiccup to work through. Anyway, I got to the UK. And I rehabbed mum for 4 weeks in her home. The quarantine stuff worked out well. If you stayed in somebody's home, you were kind of okay. And then I had to have 2 weeks in a hotel in Sydney because that's like how it rolled at that time. So that was quite an interesting time. And that was when I really had the epiphany or the revelation that with having 6 weeks of no client responsibility, looking after mum was a different kettle of fish. I was having coaching at the time as well. I just had this moment of nobody else is going to say to you, Jo, if you don't, it's fine to give up that clinic. The permission stopped with me. And I think I was kind of looking out for somebody else to maybe make that decision for me. And this ties in, I guess, with what I was talking about with my clients as well, that ownership, that responsibility, and finishing with a decision rather than letting it eke out for ages longer. So in that, it's about 2 years ago, in June 2021, I made that decision to close my clinic, and I had a slow exit, wrapping it up by December that year. And I also made the decision to start coaching.
Because we must fill a void.
I know. How funny is that?
Well, it's just this experience that we see played out over and over, that we make a decision, we create time, then we fill it because we're physicians or clinicians who are driven by overscheduling, overworking, overdoing, over. So fascinating. So you had this 2 weeks pause in life, can't see anybody, meals being delivered. I cannot imagine. I get bored in a hotel room for the afternoon. 2 weeks. Sign me up, baby, not.
Yeah, yeah,
And
not
so you did the
optional.
soul
Yeah.
searching. So you had some people.
Yeah.
You had some people you were talking to. You had a bit of a
Mm,
community going. You said you were
mm.
getting some coaching. What else? Who else was there? Who else was kind of not in the room with you, but
Yeah.
this pause? And you had that a little bit with, I guess, in England too, if you were with mom, or in the UK with mom, 4 weeks with her. I'm expecting not many visitors in and out, at least for the first couple of weeks.
Yeah. Yeah. No, we had to sit in the garden because you couldn't really have visitors in the house. And still, May in the UK can be kind of cold, but we worked on that. Look, I mean, I'm happy to share I was in Katrina Ubell's 6-month group coaching program. So I'd get 15-minute weekly coaching sessions with somebody in her team, which were fantastic. And so I had those through the 4 weeks with mum and the 2 weeks afterwards. I think there was that, but there was also the self-reflection as well. There was me and my journal. And, you know, there's a whole stack of them on my bookshelves behind me there. Like, that has been a really great way to observe myself, to be that witness of noticing what thoughts are going on and noticing how I'm reacting or responding to situations or pressures or I think that learning skill, or that learnt skill from what I learned from Katrina and beyond, of just take some time to write in your journal and see what is coming up, and don't turn it into a to-do list, was so was so helpful. So yeah, I think if you're asking who else was involved, it was actually a lot from within too, which is kind of how 2 weeks in hotel quarantine ends up being.
Got it. Yeah. Yeah. Okay. So you have a health coach, you have a clinic, you have small children, you come back from 6 weeks break, and you've had an epiphany and a decision. But we know that decision to outcome that's a pretty big deal, right? So a lot of uncomfortableness goes into changing things up.
Oh, sure. Yes.
Yeah.
Yes.
How are you feeling about that change
today?
No, in the moment.
In the moment there.
Was it excited? Was it something fearful? Like, what were you going through? Tell us the emotional barricade.
Yeah, I think what kept on coming back, and I had to work on a lot, was that sense of guilt and responsibility to patients, because I had developed long-term relationships, I guess, with my patients over the 5 years, and I know there was only one other doctor that came up and down from Sydney intermittently to do this kind of medicine as well. So again, a little bit rare, a little bit, who do I hand these people over to? I guess a little bit of a wobble at times when I didn't feel that confidence in my decision. So a little bit of uncertainty, is this the right decision to make? But I did have a colleague to refer people onto, and I continue to do that because people still think that I do this kind of work, which is fascinating how that lives on behind you. There would be a bit of uncertainty, a bit of guilt, and keeping that awareness, and I guess just checking in on, are you still happy with your decision? It was only really sitting with me. It wasn't anybody else saying I had to go either way. So and then there was also a feeling of freedom. There was a feeling of release and relief, I guess, as well, Sarah, on the flip side. So I think, as your clients will be aware of, having that wheel of emotions, of positive and negative, and the variety that we do have in life. And now I can see that and explain that, I guess, better than I might have known in the moment then. Yeah.
I'm fascinated by this responsibility that you had. So you said, this finishes with me. You know, you're my 11th doctor, and you took that to mean this finishes with me. I have to be the one to go do the things to find the answer, to find the cure, to find the ideas on how to proceed forward. in a realm of medicine where you're also expecting the patient to have that level of responsibility of, I've gone the extra mile to find the alternative ideas for how else this could be handled, but I want to give you all of that responsibility.
Yes.
Fascinating. So you've got the patient going, I'm looking for something else, a different answer. I'm not satisfied yet. What are you going to do for me?
Sure. Yeah.
And Dr. Braid says, I'll do it.
Yes. Yes. I know.
This finishes with me. I'm your answer. I'm your hero.
Yeah.
Have you noticed that coming through from earlier in your medical career, do you think?
Was that an approach I had before?
Yeah. Do you notice that same sort of idea thread had weaved its way through, or did it really just come out in that the buck stops with me now because I've said I am a functional medicine specialist?
Yeah, really good question. So I think as a rehab physician, I see the team that I work with, whether that's the neurosurgeon that's checking up, I mean, fewer and fewer appointments, but they still are there. They're a resource. There's somebody I can reach out to. In functional medicine, I didn't actually think I had a lot of allies, and maybe that was right and maybe that wasn't right, but it's still a newer area of medicine and people have opinions about everything, of course, and I just wasn't sure who I could turn to. Sometimes I had clients with endocrinological conditions, and they did have an endocrinologist and sometimes a surgeon that they worked with as well with regards to what was going on for them. With a sort of lack of confidence of how I fitted into the medical system. I think that was where it was coming from. And I didn't know who to reach out to. I had these networks in the US and Canada, some people in Australia. It's not particularly recognized by our regulatory board as well. And people were getting picked off and people were getting tapped on the shoulder. And I was practicing very conservative medicine, but I was kind of anxious that that might happen to me too. So there was sort of this unsettled feeling when I was practicing it before I'd made my decision. Sort of the longer I practiced it, somewhat ostracized actually is what I felt.
Yeah. There would have been others, like from your mastermind, some of the people you'd gone through courses with who are also experiencing this when you're on an edge of medicine that is new or innovative or unrecognized or unknown. Like you said, you've got a surgeon, you've got an endocrinologist, and then there's little old me. And I'm trying to be an expert too, but not really sure of my place. Yeah. Did any of those people, did you have a community to kind of be part of that whole, I I feel a little weird and uncomfortable and anxious in here. Was there any of that?
Yeah, there were Facebook groups that I was a part of and we could anonymize and bring client cases to. But it was more clinical and, oh, can you help me with this, these results, this path that I've got to work through? It was not so much, I don't know where I fit in the system. So more vulnerability, I think, really, to feel comfortable in talking about that with others. It was, it's actually people like fairly gung-ho most of the time. I know what I'm doing. Could I just get a few more eyes on this result? Do you agree with what my summary is?
Because you're in an area of medicine where there's no right answer. And when we really look at many medical decisions, especially when we put a human in the mix who has the problem, there's typically not one right answer. We talk about the being right persecution that we put on ourselves, that I must find the right answer. I must find the right next step, knowing that there's no right step because there's at least 3 ways out of this room.
Yes. Okay. And where do we learn that along our medical careers? Where was the teaching on that?
Mistakes.
Right.
When you're doing 100 hours a week, I'm going to suggest, is when you had to be right.
Right, exactly.
But it wasn't that you had to be right. You had to be choose the door that your team would have chosen to.
Mm-hmm. So you're one of them. So you fit the tribe. So you're thinking in the same way as them.
Yeah. Knowing that, given that there were 3 doors, if they didn't like you, they would always pick door 2 or 3 if you'd pick door number 1.
Yeah, that's it. Yes, so true.
Or just for the fun of it, like it's some sort of sport.
Yeah, I don't like that. Yeah.
No. So we can understand that this feeling that you were feeling on this edge of medicine, doing things you wanted to do to help and advocate for your patients, but with the additional piece of, I'm taking on the responsibility. There's no really other expert in the world to go and ask. This is me and my patient trying to figure it out.
Yes.
And that whole discomfort.
It was. Yeah, absolutely. Yeah.
But then you said, but then my brain changed. And I think if I was to do it again, it might look different. So tell us about that now. Now you do that work with not your patients with functional medicine, but you do this now. You kind of had this transition. So tell us what that is now. What does that look like? How do we get ourselves out of this puzzle?
Okay. So sort of what I am doing now, or how I transitioned out of that?
I'm thinking that, how did you transition out? Because you had this sentence that said, this finishes with me. I have to have the answer. And now you're like, well, maybe not.
Yeah. Okay. I think in that second half of 2021, as I knew I was working my way out, I actually reckon I was asking my patients different style of questions than I had been before, to ascertain what was their investment in their own health, to almost see what they were prepared to do as well, because an integrative medicine approach can be really quite self-involved. It's not taking a pill and all will be resolved. It's like a whole gamut of lifestyle changes that is where it starts with. So, and that's where the outcomes can come from fairly significant changes that people might need to do. So yeah, I think I was speaking to my patients differently. This decision already that this was going to end in December, and my responsibility, I guess there was that work that had come through of my self-care and my responsibility to myself. And I possibly didn't really call it burnout at that point in time, but I could tell that I was already starting to feel better in the everyday. How I guess my internal voice, my inner voice, which you might talk about with people you work with as well, that just started being kind of not so crushing, not so negative, and then we change in how we show up, I think, to other people, whether it's within our family or beyond. So those would have been some of the transitions I now look back on. I still did an exam in October 2021. I remember, like, that was the 3rd level of the integrative medicine program that I was doing, and I cleared that, but there was nothing else coming after that.
Fascinating. So you've made a decision that I'm going to make a change. I'm going to give myself 6 months to transition out of this clinic, and I'm going to go and rediscover what it is I want to do next about me. And you're doing the same with your patients. You're like, where do you want to go?
Yeah.
How much are you invested in this? How much do you want to do towards this change? How can I best support you to that? So you're kind of mirroring what you're doing now with your patients. And it's coming out of this voice where you're talking to your coach every week, these 15 minutes of, hey, Joe, what's going on the inside? What are you working towards? What are you coming up against? What are your obstacles? Like, what's getting in the way of this dream of yours that you're creating? Like, this is so interesting, isn't it?
Yes, it is. Look at that. Yeah.
You've got you on the inside going, you can do it. You really want
Mm,
this.
mm.
It's going to be hard. You're going to show up. You're going to disappoint your patients every day
Yes.
for the next 6 months,
Yes.
and you're still going to do it.
Yes.
And then you're saying to your patients, hey, you're going to hop on the scale, and for the next 6 months, you're going to disappoint yourself every day on the
Mm.
process of trying to get towards that goal weight or whatever
Yeah. Sure. Yes. Yeah. Okay. Yeah.
so interesting. So
It is,
now
isn't it?
you've got this new population of people you look after, mostly
Mm.
physicians.
Mm.
What is it that you're noticing about their journeys, and how are you helping them? What does that look like?
Yeah. And so I will say that I did do a coaching certification too. That was an error before, saying I was doing a functional medicine exam in 2021. That was 20. But I did the life coach school coach certification, finishing in October 2021. So what does it look like for the clinicians I'm working with? Well, there's a whole range from consultants to like first, second years out. So I was just wrapping up with my international client in America just earlier this week, and she's got on her chosen specialty training program. Thank you, Dr. Joe. It's all down to you. I'm like, well, yeah, thanks for the compliment, but it's not all down to me at all. We prepped up for how she could deal with long hours and what self-care looked like to her in maybe that 2 to 4 hour, if that, windows that she had at home, and how she was processing her own feelings of choosing, like, I have a choice here to not be sitting with my partner and talking with him. I'm actually going to have a relaxing shower with like a shower steamer. I don't know if you know them. I gift them for my clients, and then you get all these beautiful eucalyptus smells in the shower, quite lovely. She works through dealing with other people's opinions in the team. So she's just got on her specialty training. Yeah, she's already done a year, and the interns haven't done a year, so she's more experienced. And we sort of talked through, how do you want to show up in the team? I was curious, or she just described how she sees a team player being. If you've got 1 year of experience now, how does that wrap up or show up in 5 years as well? So that sort of future progress of something that seems really important, and I want to show my skill set now, maybe in 5 years, it's all going to be pretty similar with what you can do. And we also talked about being a learner, doing new things, doing new procedures that actually don't go, not necessarily to plan, but she wasn't able to complete them. And then how her inner voice was to her when that new skill that she's still trying to work on doesn't go to plan. And that's her self-compassion, and growth in her self-compassion is one of the main skills that she would say she has onboarded or really taken on through the 4 or 5 months that we've worked together. So very grateful to be working with people at such an early stage of their medical careers, Sarah, for sure.
Yeah. Well, like we said before, at the very beginning, everything's new. And you think you've figured out what the next step is here. And somebody comes along and goes, oh yeah, but we don't do it that way.
Mm-hmm. Yes.
And then you've got infinite choices, of course, still. You can decide, well, that I'm no good, I'll never be any good, and I should just disappear right now.
Yeah.
Or you can learn there's a skill that says, but wait a minute.
Yes. Yes.
This isn't a me thing. This is a team thing.
Mm-hmm.
I did make a decision, and the team went with the other one, and that's okay. It doesn't mean I'm bad.
No. Yeah.
And just that little difference. Like, these are things I would not have had at the very beginning.
Yes, exactly. What happens when the consultant or the attending, you're in theatre and they're like, look, I'm just going to finish here. I'm just going to get this wrapped up. They're on a schedule. There's more to do. And how do you choose to respond to yourself in the moment? Do you see that as a dig on you, that you were too slow or you weren't doing it right? Or is that their modus operandi? Is that just what they do? They let the juniors have a go for a while, and then they're going to finish it up. So so
that's right. We know
go.
that we create I'm just coming from a teacher lens, as a preceptor of learners, we know there is evidence that says we need to create a safe environment for our learners. We need to have those conversations that says you're wanted. We want you here. We want you learning. We want you to not get it right the first time. I'm here to help you navigate the errors too, not the errors like you've done something completely wrong, but okay, wait a moment, let's step back a step. We've got one step before we do that step.
Sure.
Those pieces of our learning, this is part of learning. This is what we're here for. We would as teachers, we desire our learners to understand where we're coming from when we're saying, hey, wait a minute, not that way. We're going to do it the other way.
Yes. Yeah.
So important that we've created both as teachers and as learners. We're starting to look at perspectives. Important.
Yes. And do you think that self-compassion piece does come up when you're teaching, or do you think that comes in with support, like as a supportive piece, rather than maybe dealing with the perfectionism that is quite rife in what we practice?
Yeah, so the learners coming in, like you said before, vulnerability is so important because you are so vulnerable as a learner, right? And sometimes as preceptors, we have to have some very difficult conversations with our learners about everything. Clothes they're wearing, time they show up, holidays, way they interact with other people, language they use, way they interact with other team members, like the level of vulnerability. And so we need those places to say, at times, I'm going to have a difficult conversation with you. It doesn't mean I don't like you.
Yeah.
This is part of learning. We're going to divide that so that you are awesome and you have, this thing has come to our attention and we need to talk about it. Let's go talk about it. Right?
Yes.
And then the way we do that, I think that in a lot of medicine, we're still seeing the old, dressing down in public, which is not so fun and not evidence-based, and often doesn't do our learners so much good. Things that have probably contributed to many of us having that inner critic. That if we think about who is it when we're being hard on ourselves, who is it that we're thinking that we are or aren't doing this for? Who is it that we're still trying to please?
Yes. Yeah, exactly. Yeah, good point.
And then that learning that you're okay and things happen, and just kind of dividing them up. So I'm still, I'm never doing this with bad intent.
Yeah.
And this thing happened, and let's just kind of troubleshoot our way down what happened, that self-reflection piece. So we kind of do this within the program as well. Absolutely. Yes. It's the work. Otherwise you just never certain that you're good enough. If you're just looking at the actions of other humans, the way patients take your advice and do or don't do with it.
Yes. Yep. Yeah.
That's going to wear you out real fast when you're relying on other humans to make you feel good.
Yes. Yeah, absolutely. Yeah, good. I mean, so I can give more client examples if you like more, but that was a fairly detailed example.
I think that was a really good example because it showed you a relatively junior graduate who's learning the mature skills of confidence within a multitude of human brains within a team.
Yes. Yeah.
So valuable. Yeah. So if you've got physicians who are identifying that things aren't going well for them, for whatever reason, what is your advice? Like, where do you ask them to start? What would you, if you were back there struggling in the where do I fit, what do you think would have helped first? Where do you like to start?
Sure. Great question. So for me, starting with emotional awareness, so awareness of your feelings, just starting there as the observer. So whether that can be I won't say simple, but just a one dot point every day for a month. What is my perceived level of fatigue or exhaustion or energy? or apathy, you can just look at one out of 10, where am I? So that does not take a long time. It's a single numerical data point. If that works for people, it's shorter than 5 minutes journaling, and it just invites the individual to check in, to self-reflect and go, well, where am I today? Then you can get more curious about that. Why do I think it's that number today? How is that different to yesterday? Or how is that different to a week ago? What have I changed? What have I put in place? What have I maybe said no to? What have I taken one thing off my list? So I really love starting with the emotional awareness. We know there's evidence-based that developing your emotional granularity, so that means your description of a wide range of emotions, is related to better well-being through Lisa Feldman Barrett. So I always think that's a great place to start. Personally, that was a space that I really struggled with. I had this metaphorical radiology gown that I wore since I certified my first body in my first year in medicine. Look, it definitely came off in the workplace at times, but it was also really protective in me choosing not to, or pushing away the uncomfortable emotions that came with some things that we're certainly exposed to in clinical medicine.
Wow. Yeah, that's a good start. I like that. Simple, easy, check-in questions.
Yeah.
Write it down if you want to. Okay, beautiful. Right, next. What next? Okay, so we're starting to notice that the top 3 feelings aren't so fun.
Yes. Yeah.
They're tired, they're fatigued. What next?
Sure. Yeah. So then I would be different things I could do. I guess you'd be like, well, why are they? And why are they those top 3 feelings? And I guess, do you want them to keep on being your top 3 feelings, or do you want to be like, what would you really like to be feeling?
Yeah.
And so we're going through that option of sort of choice. Okay, I do want to feel more joy in my life. What is either a thing, not necessarily a thing that I do, what's a scenario that I'm in, and then how do I think about that scenario that brings on that feeling of joy? So we're starting to bring in sort of some of that CBT based coaching tools that we use there as well. Yeah, so I would work on that. I would work on the inner voice. I'd work on, how do you hear yourself speaking to yourself when something goes right or when something goes wrong? So, and why do you do that? They often talk about judging other people. I'm like, oh, that's really interesting. I wonder if that happens to you as well. I wonder if you judge yourself too, like you might judge other people. From a place of curiosity, let's see what happens. And then I, as a coach, I love to hold my clients in that possibility of significant change, that possibility of the future that they want to be creating for themselves. And I would say when they're ready, Sarah, this is not always week 1 to 4, but at some point we are looking towards, well, when Jane shows up in her everyday as the Jane who doesn't feel so much exhaustion, or has her self-care routine, or knows what brings her joy, then what does she choose to do in that moment? And just bringing them closer to that future version of themselves that they want to work towards, because I guess it's kind of goal setting, but maybe it's more relatable. They get glimpses of how that might look, and then that invites them to think about, now, how do I want to be showing up in this moment, working towards that?
So if we were to kind of pop you back into the place where you'd kind of started in functional medicine, and you had this finishes with me thinking coming up for you, and then it changes. So you think, I have a choice here. I don't have to solve. What we're doing is together deciding.
Yes.
what is the person's goals and would they do next if they wanted to move closer towards it? How could I facilitate that with some of the things I know so I could give them direction? But the answering their health issue is not just it finishes with me. Right? I'm giving away that responsibility. So you can see how this neatly ties into, first you're noticing this heavy weight, anxiety, stress, guilt about these patients, and then you're moving into something different with regards to the thinking. You're like, this doesn't finish with me. Hang on a minute.
Yes. Yeah.
Actually more about them and how much they're interested in doing. Oh, I wonder what would happen if I asked them that question instead.
Yeah. Yes.
And that remaining curious, that you have choice here. So same patients, same building, same staff.
Yes.
Suddenly Dr. Braid is different. She's showing up to work differently. She's not as anxious and guilty. She's not taking patients home in the same way.
Yes. Yeah. That's it. And that's helping with that delineation between work and life, which I'm sure you definitely address with your charting champions. Yeah. And as we've gone through this sort of hybrid era of recent years as well, is that a lot more blurred? I don't know. Also in medicine, I think we have been quite contactable out of hours anyway by the very nature of what we do and what we're in. But yeah, maybe some of this approach also helps with that decision to, be switching off and being with the family or being with who you're with at home, even if that's yourself. Yeah,
that's right. It's deciding, what do you want? I know we've had some, we have different seasons of medicine. And certainly when we were talking to Natasha, recently, one of the people who came on, she's like, I had this period of time where I really wanted to be really busy and I could do nothing but lie on the couch when I got home. I had given everything. But then I moved into a next season where I had a little person coming and I was like, this isn't the model that's going to work anymore. And so it's that noticing, this model right now is not working for me for whatever reason.
Yeah.
Small kids, just don't like it this pace anymore, different season, want to change. And then just saying, you have a choice. It is possible.
Yes. Yeah. I think that really is quite a life-changing sentence to carry around with one. I have a choice here. I'm choosing to procrastinate on doing X, Y, Z, and I'm choosing to do the laundry instead. Okay. Great awareness. Okay, do you want to keep doing it that way? It's up to you. I don't mind. Yeah, I'm choosing to.
So good. Where could people find you if they're interested in learning more about your work or working with you?
Thanks, Sarah. Well, I hang out on my website is drjobraid.com. I have a podcast, the Burnout Recovery Podcast, available on all the major platforms, and on socials, I am at Burnout Recovery DR, so Burnout Recovery Doctor, and I'm on LinkedIn at Dr. Jo Braid as well. So those are the main areas.
Perfect. Good. Anything that you came here and you wanted to tell us and I had forgotten to ask you before we wrap up? Anything else? What did we miss? We
did 3 questions at the end of we talked about 3 take-home messages I'd love to share with your listeners.
Great, let's do it.
So my answers were, there is no right path to follow in medicine or any career. I think it's really up to you. It's your life. It's your one precious life, and you make those choices of what you'd like to do. Secondly, if you need help, ask for it. I still think this is a challenge in our workplaces and sometimes even in our homes. And thirdly, bring self-compassion to your everyday. Treating yourself with kindness, not judgment, changes the experience you will have.
Ooh. Say more. Just a little bit more on that.
Well, let's talk about getting in the shoes of that junior doctor that I was talking about before. And she has the tools taken off her in the operating theatre, and the attending is going to wrap up whatever surgery they're doing at that time. So she's standing beside the attending and mulling over why this has happened, and did I just do something wrong? Did I say something wrong in the last minute or 2 minutes? Did I take too long? And maybe questions are coming across her mind that are critical and putting herself down, and maybe they are coming from a previous lived experience where those were the questions asked, and that's why something stopped there. With opening her eyes or bringing that kindness and self-compassion to the situation, you know, I would say, thanks, human brain. You are giving me all these reasons from a previous experience that I've had that is trying to contribute to why I am responding in the way I am. I'm actually going to be more accepting, I guess. They said that for some reason that they know about in their brain, and I can sit here and just be at peace or accepting of their decision with what they wanted to do then. And then I'm going to be probably more engaged, actually a better communicator and more receptive to learn in this scenario, which is still a very much teaching scenario for this person. And I'll probably get more out of, or I'll just enjoy the experience more of wrapping up this surgical case. Does that sort of relate?
It does so much. I remember being a surgical intern way back when, and you're absolutely right. So the taking of tools off you, you could totally say to yourself, I'm bad, I'm wrong, I'm slow, whatever it was. You could say, I'm so thankful he took those off me. I didn't really want to close, actually.
Yes.
You could think, fantastic, we get out of these scrubs faster.
Mm-hmm.
You could think, oh yeah, we've got 3 more cases ahead of us. Of course, we want to wrap this one up quickly. We could think, yes, I'll get to tennis on time, or whatever it is you decide to do after work. And if you're not introspectively cursing at yourself and being the critic that you don't want to hear out loud from your boss, if you're the one being that mean to yourself, there's no way you're going to ask your boss, why did you take the tools off me? Because you're expecting to hear what you've just said to yourself, right?
Yes. Yeah.
You're so slow. Why would I leave you with the tools? But if on the inside you remain curious and you're like, I wonder why he took the tools off me. It could possibly be because I'm slow, and so maybe I do want to go practice, or maybe it's because I've got 3 more cases, or he wants to get to dinner on time, or he's got kids to go pick up, whatever it is. If we know that our voice is optional, what we say to ourselves, and we're kind to ourselves, we're going to love ourselves even when we have suture practice to do.
Yes.
And feel brave enough to say, hey, by the way, why'd you take the tools off me? Super curious. I don't care. I'd love that you want to finish up the case. I'm just curious. Was it a me thing? Was it a thing?
Yeah. What can you find out from that situation? Yeah.
But you're never going to say that if the inside of you is being absolutely nasty already ahead of time.
Yeah, that's it. Yeah, so true. Good. Yeah.
Well, I've really had fun doing this conversation. Thank you
Me
so
too.
much for going to all the corners for us.
Thank you, Sarah. We have covered a lot. It's been an absolute pleasure to be on your podcast. I've really enjoyed it today.
Yeah, enjoy the well, you're not having summer. We're having summer, but you're having winter. That's okay. All right.
We are. Yeah.
Until next time.
Thank you, Sarah. Bye.
Thank you for being part of the Sustainable Clinical Medicine podcast. If you'd like to learn more or join us to help you get home with today's work done, go to chartingcoach.ca. There you'll find all the information on the premier Lifetime Access Charting Champions program that is helping physicians get home with today's work done, with all the proven tools, support, and community you need to create time for your life outside of medicine. We would love to see you there. Until next time, thanks for listening.